All right, let's jump right in. Today, we're going to break down something that's at the very heart of medical evidence in nursing, the quantitative research design. Think of it as the essential blueprint for discovery. I want you to picture this. Your hospital introduces a brand new protocol for wound care, or maybe a new way to manage pain. Now, it sounds great on paper, but how do we actually know if it's any better than the old way? How can we be sure? Well, the answer to that question is all about the design of the study used to test it.
So to figure that out, we have to start with the plan itself. We have to understand the blueprint.
At its core, a research design is exactly that. It's the master plan. It's the entire strategy. It's not just about what question you're asking, but it's about how you're going to find the answer. It lays out every single step, who you're going to study, what you'll measure, and how you'll analyze everything to get a clear, reliable result.
You know, the most important job of this blueprint is to create control. It's kind of like building a soundproof room for an experiment. You want to filter out all the extra noise, all those other factors that could mess with your results, so you can be confident that what you're seeing is the real deal and not just some fluke. So every single quantitative researcher, once they have their question, comes to this fundamental fork in the road. And the choice they make right here, it sets the entire course for their study and dictates the kinds of answers they can even find. And this is the big choice. On one side, you have experimental designs. This is where the researcher is an active participant. They do something. They introduce a change, an intervention, to see what happens. Then on the other side, you have non-experimental designs. Here, the researcher is a totally passive observer. They just watch, measure, and record things as they happen naturally.
Okay, so let's start by taking a walk down that first path, the active one, where researchers are deliberately getting their hands dirty and testing an intervention. Now, this active path has a few different routes, and we can pretty much rank them by how powerful they are. You've got true experimental designs at the very top. That's the gold standard. A step down from that, you have quasi-experimental designs, which are super common. And then there are pre-experimental designs, which honestly are considered pretty weak. We're going to focus on the first two. The true experimental design. This is the heavy hitter. It is hands down the most powerful method we have. Why? Because when it's done right, it's the absolute best tool for proving that one thing actually causes another. It's all about establishing that cause and effect relationship.
So what gives it this incredible power? What's the secret sauce? Well, it boils down to a combination of three essential ingredients. First, you've got manipulation. You actually have to do something, introduce that new treatment. Second, you need control. This means you have a comparison group that doesn't get the treatment to serve as a baseline. But the real magic ingredient, the one that makes it so powerful, is randomization. This means you assign people to the groups by pure chance, which helps ensure that both groups are as identical as possible from the start. So, take a look at this diagram. This is a perfect example of a classic setup. You'll see you measure both groups right at the beginning. Then, the experimental group, that's E, gets the intervention. We'll call it X. The control group, C, gets nothing new. Then, after a while, you measure them both again. If the experimental group shows a much bigger improvement, you have some seriously strong evidence that your intervention, X, was the reason why. Okay, so what happens when you can't get all three of those perfect ingredients? Well, then you have a quasi-experimental design. It's almost a true experiment. You're still actively intervening, but you're missing one of those other key parts. And usually the thing that's missing is randomization.
And this is just so critical to understand. In the real world of nursing, you often can't do things like randomly assign patients to different groups. It just wouldn't be ethical or practical. I mean, you can't tell one patient, hey, you get this amazing new therapy, and another, sorry, you get nothing, just by flipping a coin. So the quasi-experimental design gives researchers a strong, practical, and ethical way to study things, which is exactly why you see it used so often in nursing research.
Right, so that was a path where we're actively doing something. Now, let's head back to that big fork in the road and explore that second path, the observational one, where the whole point is just to watch and understand the world exactly as it is.
On this path, the researcher is kind of like a detective. Their goal is to observe, not to interfere. So, a descriptive study might just try to get a snapshot, like what percentage of new mothers experience anxiety. A correlational study looks for links. Is there a relationship between how much sleep a nurse gets and their rate of making errors? A survey could be used to gather opinions from hundreds of patients about their hospital stay. And an analytical study might look backward in time to uncover risk factors for a certain illness. Each one is a different tool for a different kind of observation. The biggest takeaway here, the main thing to remember for all of these designs, is that the researcher is completely hands-off. They are just observing, measuring, and describing what's already there. They aren't changing a thing. Okay, so we've looked at the two main paths, intervening versus observing. Let's pull it all together. Why does this really matter for nurses on the ground, for you, and for the patients you take care of every single day?
It matters because the blueprint you choose directly determines how strong the final evidence will be. An experimental design is what you need to talk about cause and effect. A non-experimental design can show you powerful connections and paint a detailed picture of a situation. Choosing the right design for the right question is absolutely crucial for getting answers we can trust to guide how we care for people.
So, to wrap it all up really quick, remember that the research design is the study's blueprint. The single biggest choice is whether you're going to actively intervene, that's experimental, or passively observe, that's non-experimental. Experimental designs are your go-to for proving cause and effect, and non-experimental designs are absolutely essential for describing what's going on and exploring relationships.
And that brings us to a final thought to chew on. You know, with everything changing so fast, with AI, personalized medicine, and all these new global health threats, the questions we need to answer are getting more and more complex. So what kind of brand new research blueprints are we going to have to invent to build the evidence we need for tomorrow?